Hey guys, it's Nick Davis, creator of Blast, and I'm joined once again by the wonderful Dr. Katelyn Campbell, who has just, let me hand it over to you and you tell us what you've just done recently.
So I believe, I guess I have treated the youngest person successfully with Blast. I don't
So
know if that's a title I get.
the youngest person I've ever treated with Blast that we have records for is age 6, but I believe you've gone one better.
Yes, so I have a 4.5-year-old son who had struggled with what I suspected had been what we call in the field like a preverbal trauma, something that's happened before anyone has the ability to develop memory of it. And this was from some procedures that he had to undergo as a baby in the neonatal intensive care unit. And so he had to undergo a ton of blood draws out of his feet, unfortunately. So this poor little premature baby had to have all these blood draws from his feet, came home and he recovered. His health was good. We were able to bring him home. But I remembered looking at his feet and thinking like, oof, like that looked so painful.
Yeah.
And years later, we noticed that like he had a really strong aversion to anyone going near his feet.
Mm.
Um, and normally we were kind of just like, well, okay, we'll just give him his space. And it was only recently, even actually during my blast training, that I kind of made this connection that I was like, I wonder if these two things are connected. So one of the issues that he's had is that little kids have to have like their toenails clipped. Otherwise, it'll start to cause problems on, your feet. It's just sort of a natural thing that needs to be done. And he would not let anyone touch his feet. And finally, one night out of desperation, I was like, I'm just going to give this a shot. I had no idea if it was going to work.
Mm.
But I sat him down and I, walked him through. I said, I want you to actually think about and really get to the root. It just like he doesn't remember, but I said, think about how scared you feel and think about what you're afraid is going to happen. And he was able to, 4.5, follow the light.
Yeah.
He said he felt his brain calm down.
Wow.
Yeah, which was amazing.
Wow.
Yeah.
That is incredible.
And um
And,
and
and
he was able to
since
do it. Yeah.
and since that, what?
So since then, he let me then immediately afterwards go
Immediately.
through and clip his toenails, and he
Wow.
was thinking and saying like that didn't hurt at all. And so I was amazed that this that I was able to actually see this happen, and not even in a clinical setting. This was, just kind of at home, just with him. And yeah, and so hopefully we will see that sustain, but he hasn't had an issue since. So it
Wow.
was
Yeah. Keep,
wild.
keep us posted. I mean, one of the things that you said, it wasn't in a clinical setting, it was just you guys at home. But that's part and parcel of the blast technique that we create that space. We utilize a nurturing parent ego state, and there's a lot of kindness and compassion involved in blast. And I think, as we were discussing, previously, that allows the brain to open up to give us access. Now, yeah, this is just for the viewers, but the hippocampus, the part of the brain, it's kind of like a seahorse shape that allows us to lay down episodic memories, doesn't really form until the age of 2. This is what people don't realize. So even though we have pre-verbal and memories that we can't actually access, we get these kind of somatic experiences that are stored in part of the brain called the dorsal striatum. So what the dorsal striatum does, it tends to store things like feelings, sensations, and things like that. And this is what I love about this story. Two things. One is it's a pre-verbal and it's before his hippocampus is fully formed, so he won't have a conscious memory of it. But also, you managed to treat him at 4.5 because previously I thought 6 was the limit because of them being able to focus. So you've actually just created a new world record for blast. So well done on that, and well done to your son. And what an amazing thing! Because how many times, kids, there's so many things that I've treated where in vitro when it's problems in the womb or with birthing and things like that, both for mother and child. And we think about all these things that can affect children later on in their lives, and you managed to heal it at such a young age. So that is absolutely incredible.
It is amazing, and I will have to tell him that he holds a very special record. I think that will please him a lot. Because he was, and it was funny afterwards. He was like, he was trying to wave around his blast pen and stuff because he was like, this was fascinating. So it was a very special moment that we got to have that I like, which just blew me away that we were able to help him in that way.
Caitlin, thank you so much for sharing that story. That's going to help lots and lots of people. Thank you so much.
Thank you.